So today we are going to be going over how to do a daily encounter note on Insight Go Clinicient here. And first things first, let's start off by searching for our patient. So in order to find a patient, what we're going to do is go up here to this little magnifying search glass here, and we're going to type in the patient's name, okay? So I'm going to be using a patient that is fake, just for an example here. So once you type that in, their name will pop up down here, and once you find it, just click on the patient's name. And the first thing that's going to do is pull up their demographics page here. So you can see their name, date of birth, address, phone number, a lot of the important information on the demographics here. If there's any important notes like a specific person to text or call for appointments, it will be over here, and emergency contact information down below. The next thing we're going to see on this left sidebar here is appointments. So if we click on appointments, you can see all of their past appointments. And again, this is a fake patient, so a lot of this is just for training purposes. But when you're going to do your first daily encounter note, you'll see likely an initial evaluation with intake here, and that will have been done by the physical therapist. So if we just click on this one, for example, we can look at this evaluation that was done. So you'll see a lot of your pertinent information here on the patient. And as you scroll down through this note, you'll see your typical subjective, objective, assessment sections, and the plan. So this is an important section to look at, and on an actual evaluation for a real patient, this will be filled out. So it'll tell you the total number of visits that are recommended for the plan of care, the frequency, how often per week, typically 2 to 3 times per week, and then the duration of each visit, etc., etc. So this is just taking a peek at the initial evaluation here of a patient. We'll get into the actual note here shortly. And one last thing to look at on this left sidebar here from searching your patient is attachments. And so here there will typically be one that says medical report, and you can click on that, and that medical report will have either their script or information from the doctor regarding their diagnosis or a certain type of procedure or something that they had, or the reason why they're having physical therapy. Okay, so this is all just from that search bar here, searching for patients. Again, demographics, appointments, and attachments. Those are really the 3 important things that you need to look at here. So if we close out of that, it takes us back to our main schedule screen. Okay, this is what you're going to see when you first log in. Now let's say I want to go ahead and schedule an appointment for a patient today. And let's say I saw this patient at 4 p.m. today. So you'll see your weekly chart here, Monday through Friday. And let's say I saw this patient today at 4 p.m. So I'm going to go under today's date, which is Tuesday, October 31st. And we're going to go to this time slot here of 4 o'clock, and I'm going to right click this, okay? So once we right click in that column, this is going to pop up, and we're going to go to add appointment. Okay, so once we get this pop up, the first thing we're going to do is type in our patient's name. So again, I'm using this fake patient here as an example. Okay, we always want to make sure this case is on PT. So it won't say PT training on a real patient. It will say physical therapy case and then a number. Okay, so it's always going to be a standard visit for your daily encounter. The appointment status will be scheduled when you're scheduling the visit, but once you go see the patient and you're doing your note, we need to change it to arrived in order to start the visit note. Okay, and then the next things right here, you'll confirm your date that you saw the patient and the times that you saw the patient, okay? So once this is all correct, you just hit review and schedule. Okay, so you can see now that visit pops up on my chart. And so I can click that. Okay, it'll pull up a little sidebar here. Now, if you right click this again, and we go to open chart, that pulls up our daily visit note, okay? So what we're gonna do now is we're gonna go up to this top right corner here, and we're gonna set this note up in the format that it needs to be. So we're gonna hit add template, okay? Then once this pop-up comes up, we're gonna go to Life Care PT, and we're gonna go to 1E, which is daily encounter note, okay? So this is for your regular visit note right here. Okay, once we have that checked, we hit apply. Okay, so that's going to change the formatting of the visit here to have everything you need. So now we can just go straight down through the note. So purpose of today's visit, skilled therapy consistent with plan of care. Patient self-report, good response to treatment. If you need to change any of these, you can just type in here anything that you want to type in, or you can click these three dots and choose any of these options here. Let's say you want to say no adverse reactions, you just click that and it adds right to the chart. Okay, family caregiver report. This is where you'll give your subjective report for the patient. So patient states that her legs are feeling fatigued today and that she is having to take frequent rest breaks during standing activity. Something like that, right? Nice subjective. Now, we'll just keep going down just like this. So compliance, and if this is relevant to your note, you can just check it and move on, okay? Anything with a red or a green star means that this is a goal for the patient, okay? So if we right click this area, okay, we can look at the goal and see the different status of the goals, okay? Same thing here, the desired value is 0. So if you want to make a note on any of these goals here, like let's just say patient's pain is improving overall, something simple like that, you can, and that's just a note kind of towards that goal for today's visit. All right, so that's the subjective assessment there, or the subjective portion of the note there, rather. All right, so if we keep moving down, the next section you'll see is objective, okay? So again, just make sure all these boxes are checked. You can put in the blood pressure, heart rate, respiratory rate, just your vital signs here, okay? So we'll put those vital signs in for every visit. And then as you continue to go down here, you'll see more of these stars, and these are all more goals for the patient, okay? So if there's something relevant that you worked on that visit, you can change, or add this to this area here and just say on any of these notes section, make sure it's on this notes. So let's just say the static sitting balance, you can say patient performed static sitting balance exercises and is progressing well through exercise routine, just something simple like that, right? It doesn't need to be too specific. We'll get into the exercises and everything a little bit later on in the note. Just an example. Okay, and so that's the objective section. Again, just vitals and then filling out any notes relevant to the goals that are on. All right, so again, these are 2 more goals right here, and it looks like these are like a transfer goal and a dressing goal here, like an ADL type goal. So if you had anything in your visit to add to those, you can add them right there in the notes section. Okay, and now we get down to assessment here. And so you can type a brief assessment here in the summary section, and that's just kind of your paragraph of how the visit went, right? How the patient is responding to your treatment that day. Okay, and then we can just come down here, progress made, continued deficits. So any deficits that we're continuing to work on with the patient, any specific progress that they made that day, you can write here. And then clinical impression, you can just click this and leave it as is if it's relevant, patients responding to as expected to the therapy program, okay? So plan section here, all we have to do, 3 check boxes, okay? And we're done with that. So again, a lot of this is just checking the boxes and filling in this section here, but if it's already filled in and it's relevant for the day, then you can just leave it as is. Okay, and then last but not least, we're down here in the procedures section, okay? So this is gonna be our billing section for the note. So we'll go ahead and delete these for now. And these are the different CPT codes that we can bill, okay? Now, for billing purposes, we're only going to be billing neuromuscular reeducation if the patient has a neurodiagnosis, okay? Like a stroke, Parkinson's, MS, something along those lines. If it's an ortho case or just a general case, we're not billing out for neuromuscular reeducation, okay? Now, you'll see some notes here on the side of the CPT codes, right? So on therapeutic exercise, you see 3 times 10 hip abduction, extension, flexion, rest periods as needed, and educated patient about posture, okay? So what you're doing relevant to the CPT code, we'll put in the notes here right in that same row as the CPT code, okay? So let's just say for this visit, I'm gonna bill out 5 units. So we're gonna do 30 minutes of therapeutic exercise. We did 15 minutes of therapeutic activity, 15 minutes of gait training, And then let's just say we did 8 minutes worth of self-care home management training, okay? So that's going to give us 68 minutes here, and that is a 5-unit treatment. And if we look at the top here, okay, up here, you'll see it's in red right now because we're billing 68 out of 60 minutes, okay? Now, if my billing is 68 minutes, I need to make sure my visit time in and out is also that. So I can change this to 508, right? And now we're blue here because we're 68 out of 68. So you want to make sure those units and time line up. And if it doesn't, don't worry, because it will stop you and it won't let you move forward until you change either the time or the units that you have billed. Okay. So now anytime throughout this note, if you need to save, what we're going to do is come up here, okay, to these orange icons where we added that template before. We're going to go all the way over to this one here and we're going to hit save, okay? So if you're walking away from your computer or doing anything outside of this, I would recommend saving just so you don't lose your progress, okay? So once you click that, it will automatically save your note. Now, once you're finished with your note and you're ready to sign off on it, what you'll do is you'll come up here and hit the sign off button. Okay, it'll save your visit. And since this is a fake patient, it's actually not going to let me sign off, but it's going to pull up a pop-up when you hit sign off, and it'll just verify the units and the time that are billed. And you can just hit next, and then it will come to another screen that says, do you want to fax this visit? And you don't have to do that. You can hit next again and just keep hitting next. I think it's only 2 times until the final screen comes up where it's going to prompt you to put in your password to sign off on the visit. And that password is the same as what you use to log into the system. Okay, and then once you type in your password, you can hit the little orange sign off button that's on the pop-up, and then it will sign off your visit, and you can exit out of it, and it will take you right back to your schedule page, okay? And then once you have signed off on your visit and you're looking at it again, it'll have a little lock icon right here saying that it's signed off on and locked now, okay? And so that is basically how we're going to schedule and document a standard visit here on the LifeCare Insight Clinician system.